This training program is a detailed training program for those who are ready to use the ECHO model. This training is specifically for our sign partners. Through this training, our partner will not only gain out valuable insight or knowledge about ECHO, but also it will help us to build a lasting relationship with the ECHO staff as well. And this connection will help us to ensure the successful use of ECHO model in near future. And I would like to thank everyone who has helped us to make this event possible.
It is with great pleasure and honor I stand here today in this Nagaland Healthcare Partner launch training, an event dedicated to fostering dialogue, innovations, and collaboration within our healthcare sector. I'm very delighted and strengthened also to have the authorities in our midst this morning. This gathering signifies our shared commitment to advancing the health of well-being of our state, Nagaland. The government of Nagaland has steadfast in its focus on improving the lives of its citizens, recognizing the pivotal role that healthcare plays in enhancing overall quality of life. Significant investment has been made to bolster the healthcare infrastructure across the state. A prime example of this commitment of the government and every citizen of the Nagaland is the inauguration of Nagaland Institute of Medical Sciences and Research, that is NIMSAR, in Kohima. This institute is not merely a hospital, but also a beacon of research and innovation. The establishment of NIMSAR marks a significant milestone promising a tremendous upsurge of healthcare upliftment and development in the healthcare sector. The government's vision is to extend beyond the urban center. In the centers, there is a concerted effort to ensure that the knowledge and benefits at the center extend to the peripheries and reaches to the furthest corner of Nagaland. It is imperative that individuals in urgent need of healthcare can access to it promptly.
When Nagaland attained statehood, our health infrastructure was under-equipped, with limited access to advanced medical technologies and trained healthcare professionals. Today, healthcare facility in the state has been significantly enhanced in all district hospitals. We have TB, tuberculosis, and chase disease hospitals, a state mental health institute, community health centers, and our state's first medical college in the state capital. Construction of Mon Medical College is in full swing, and laying a foundation stone for nursing colleges in Kohima and Mon are in the pipeline. The priority of our state government has always been to provide comprehensive health infrastructure to all the citizens of the state, and our proactive approach is to ensure healthcare that is accessible, affordable, and available to all at the right time and in the right place. One of the key initiatives in this endeavor is the Chief Minister Health Insurance Scheme, designed specifically for the people of Nagaland. This whole scheme, launched in collaboration with the central government's Ayushman Bharat scheme, is a significant step towards achieving Nagaland's 2030 Sustainable Development Goal, which was launched in August 2021. This goal strives to guarantee that all citizens of Nagaland have access to fair, economical, and high-quality medical care by 2030. Department of Health and Family Welfare is contemplating to introduce more services under Chief Minister Health Insurance Scheme in the days to come. This will achieve the intent of comprehensive healthcare infrastructure in the state. Any permanent and indigenous residents of the state who are not enrolled in Ayushman Bharat or any other publicly funded insurance program can be covered under Chief Minister Health Insurance Scheme. Nagaland, being a community-driven society, by involving community and imparting trainings, will empower primary health clinicians in rural and undeserved areas with the knowledge and support that they need to provide expert-level care. This standard of knowledge ensures that every patient, regardless of where they live, can receive the highest standard of care. It is about equity, empowerment, and excellence in healthcare. Today, as we bring this innovative model to our state, we are not just launching a program, but we are igniting a movement that will transform the health landscape in our state, making specialized knowledge accessible to all healthcare providers, irrespective of their geographical locations.
So what is Echo India's mission? It's empowering primary clinicians with the right medical knowledge that can save millions of lives. You know, our tagline is very simple: move knowledge, not people. Over the years, we've seen in each of the places where we all reside that people come to where knowledge is. They come to the specialist hospitals, they leave their livelihood at times, especially people in underserved areas, mortgage land, borrow money, and come to get the right treatment. And we started off with one man's vision of if that knowledge could be there where the patient is, how would it overturn this entire paradigm of treatment? Can we move knowledge rather than move people? So what is our aim? Our aim is to democratize knowledge. Our aim is to make knowledge available where it should be. That is the core seed from which the Echo movement has grown. And that is what governs all of us. That can we shift the knowledge to where people need it? So let me just share Echo India's brief history. We started off in 2008. Echo globally started off in 2003. In India, we were registered as a charitable trust in 2008. But honestly, from 2008 to 2014, 15, nothing much happened. And what changed in 2014? It was the internet revolution, the availability of broadband, the availability of data connectivity reaching out across India. And Echo uses technology to amplify the reach of scarce resources. And scarce resources are people who have the knowledge. And in those days, we used Zoom as a platform. And now we have our own platform called iEcho, which incorporates Zoom in it. You will get to know about it. So in 2014, suddenly there was traction because we could start doing video conferencing. So NIMHANS, NICPR and NITRD partnered with Echo India to start their capacity building programs. And you will keep seeing this over time. We work through partners. Y'all are the way we reach the underserved people. We don't do anything directly. Y'all actually do the work. We stay at the sidelines coaching and mentoring y'all to the best of our ability. In 2018, NTEP adopts the Echo model for capacity building. NHMs start their partnership programs. NHSRC, 2019, NIMHANS came in NICPR, and you can see the names out there. And today, we have over 400 plus hubs. Hubs are teaching entities. The entities that have the knowledge, spokes are the learners. That's the jargon that you will hear me use throughout this presentation. We have over 1,000 plus completed programs. This number keeps varying. It is 1,050, 1,070, so we just say 1,000 plus. We ramped up extensively during the COVID years. COVID years were, very troubled, dark years, and a lot of knowledge had to shift very quickly to the people who needed them, whether it was confidence in the immunization, in the vaccine confidence, advocacy programs, whether it was treatment protocols, whether it was reaching out to ASHAs on how do you manage and how do you identify infection, how do you manage. We did all of that here. And recently what we've done is we've also signed up, we moved into livelihood here. We've also signed up on Jal Jeevan Mission. Ministry of Agriculture has also looked at this model, because this model is a mentoring model. It is disease agnostic. Within health, it can be used to look at tuberculosis, it can be used to look at COVID vaccination, it can be used to look at cancer prevention. And outside it can be also used in education and in upskilling school leaders, in farmers' livelihoods, in various ways.